Hello, hello, hello. What's up, everyone? Hello, and welcome to another captivating episode of the Know Your Pharmacist live stream. I'm your host, Dr. Joaquin Acosta, CEO of Pharmtrue, and I'm thrilled to connect with you all again tonight. We've got an excellent lineup, everybody, that's both enlightening and practical. Again, September, Healthy Aging Awareness Month, among many other things, but we're going to be touching a lot on that tonight. So, again, very good. Just like High Horse, the sponsors of our Herbal Wellness segment, guys, we're not just reading history, we are writing it together. So, again, get ready, get that favorite cup of tea, coffee, warm or cold beverage, and let's dive into this segment of science, soul, pharmacy, and wellness. First things first, guys, up on the Pharmacist Frontline, looking to dissect the FDA's new COVID 19 booster. The recommendations rolled out today. CDC just green lighted the new booster shot yesterday. So that's going to be rolled out. New Pfizer and Moderna vaccines. Very interesting. Ken, not just about the shot, guys. It's about empowering you with knowledge to make informed decisions. In our Tech Talk, we're going to be brainstorming ways to make social media accessible for our senior citizens and looking at actually some of the science behind all that. After all, love and connection know no age, and we know science supports it, guys. Our Enlightenment Hour, we're going to be exploring the fascinating concept of reverse mentoring. That's a collaborative journey where we're both young and old can learn from each other. In the Herbal Wellness Corner, we're going to dive into the role of cannabis in skilled nursing facilities. Talked a little bit about it before, but again, need to reintroduce some of these concepts and want to go over them. Not just about symptom management, it's about enhancing the quality of life. And is medicine available right now and accessible in that sort of environment? The state law says no because of federal law. So again, that's where we're at right now. After that, our community spotlight can be shining on the Centennial Hawks cheer team and their collaboration with Papa John's Pizza. Slice of pizza can go a long way in supporting our local talent. So we'll be hooking you guys up with the details on that. And last but not least, our Men's Health Minute will focus on gout awareness today. We're going to provide a productive tips to manage this painful condition and just to be aware of it in general. Big thanks to our show sponsors, Pharmtrue, High Horse Cannabis Company, the Trichome Alliance, and Vado Speedway Park. Your support makes this all possible. So are you all ready for an interesting, great, and creative journey tonight? Let's collaborate to make this the most engaging episode yet, guys. Smash all your questions in there. Let me know what you think when it comes to senior time. So first things first, unpacking the FDA's new recommendation for boom, 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 COVID boosters approved for all Americans over the age of 6 months amidst rising cases and hospitalization. So boosters may be available this week. You're gonna have to check with your pharmacies, local pharmacies, health, NMDOH Health Department there on Solano for those of us in Las Cruces. But again, there's literally going to be the new booster recommendation that's going to be dropped. Walgreens and CVS usually have been getting all the booster vaccines first, the updated ones. So apparently now everybody above the age of 6 months is supposed to get boosted with the new booster, which may be available earlier this week. So yesterday, the FDA authorized and approved the new booster made by both Pfizer and Moderna. Um, these are related to the new variant, right? So this is the new updated COVID booster that's now available, guys, for everybody's information and recommendation. Want to just make sure that you get that on your agenda right now. Again, we've got the trifecta as it starts to get cold of RSV, flu, and COVID. Again, get that flu shot here. It's starting to become that time. Might as well go ahead and get it taken care of. Next time you can, stop on by the pharmacy or your provider's office, anywhere that you might have it available. Go get that new flu shot, the new COVID booster. I bet within the next 2 weeks to a month is going to be out everywhere here in the state of New Mexico, and we're going to continue to hear a little bit more about that. But everybody age 6 months and up should be expecting to do that. That RSV shot, the updated new one, all infants age 8 months and below. You guys and those being born during the season should be getting that new RSV shot, as well as adults over the age of 60. You get a different RSV shot, but you should be getting the RSV shot, right? So flu vaccines, adults over the age of 65 get the high dose flu shot or the Fluad. It's a couple different variations. We talked about it last Friday. Everybody else 6 months and above gets the flu quadrivalent vaccine. And those are your quick updates on that. I mean, really shouldn't be much more. Just realize, guys, nobody has gotten the new booster shot yet. So that's what I'm saying. It's very easy to think I'm all updated, I'm ready to go. But as of today, September 12, 2023, you are at a complete reset, new COVID shot. Then you're current. So, you heard it here first. You won't get it anywhere else yet. Keep your eyes and ears peeled, but I just want you guys to make sure that you guys know. Again, new COVID booster approved. It's go time when you can get it available. Cool. Moving on, Tech Talk, guys, talking about navigating social media for seniors. Again, social media for seniors and everybody else, but it does have very, very positive impacts and correlations on benefits towards aging. Impacts and mindsets to reduce loneliness, help improve cognitive function, be a little bit better at actually processing information, keeping the family together, increasing feelings of social connectedness and life satisfaction. So what does that mean, everybody? Well, seniors have a gap in the ones who know how to use it and the ones who don't. So again, how do we increase and onboard all of our seniors to get to use their social media? How do we increase that digital literacy there? So according to data from Pew, 72% of all adults in America use some sort of social media in 2019, including 69% of those age 50 to 64, and 40% of people age 65 and older. So where we have those numbers of 40% of people age 65 and older, so what would you think? Probably people with families very tied and connected are more likely to have that social media versus those that may be alone or isolated. Again, what can you do to help onboard your aging family member onto social media, teach them and be patient about it? We're going to talk a little bit about that right now, actually. And I just kind of want to, give a little bit of a shared resource for you all here on how to introduce, social media to seniors, some of the recommendations that were very interesting to uncover here. Let me fix the screen. Sorry about that, everybody. It always goes wonky on me for just a moment until I fix it. Of course. There we go. Thank you for your patience. So looking at this one, this is a cool little document about a social media for citizens senior course. And again, just to give credit where credit is due, this is a University of Massachusetts document, and they actually had a class, graduate program class here designed for it. And I like this final project that this person gave because there's a couple different agendas for how to introduce specific social media platforms, recommendations. They used the Wauburn COA Senior Center as the basis for education. And that's pretty interesting too, because giving a resource there through that senior center to get, seniors connected to social media, that's a very smart idea, right? Looking here, what sort of skills may senior audiences need to have to even use social media here, right? Probably got to at least be able to read and write some basic computer skills, having the access to the mobile device, good attitudes towards training, some motivation there. Where can you look at the other accessibility issues like impaired vision, impaired hearing, impaired mobility. So, looking at these analyses, there's multiple different barriers for why seniors wouldn't necessarily want to use social media, which is totally fair, right? Health issues or limiting physical abilities may hinder senior citizens from participating in common daily activities, including learning or using technology. Skeptical attitudes about the benefits of tech. Many older adults question the benefits and wonder if it is worthwhile to spend time to learn new tech. Benefits are not immediately clear to all, especially to those who have not used technology in the past. Difficulties. Oftentimes, there's the fear of the unknown when it comes to learning new tech. Seems daunting. Some people don't want to use that. So you're looking at these barriers, right? And you got to look at strategies for how can we accommodate the needs of teaching older adults. So here, this was a proposition from 1998 shown here. Breaking up instruction into small units with specific goals and relate new information for older adults' existing knowledge. Allows sufficient time during instruction for older adults to process, events and information. Provide more pauses during lectures so that older adults have time to take notes, and allow them to ask questions during instruction to help clarify information. Minimize the amount of reading required during instruction. Allow them to practice after it's taught, right? Interesting. Where can you familiarize them with online help features that help you get by? Whether it's using the phone, nowadays it's chatbots and all these things, but most of the general mobile and computer functions these days are downloading an app or a program and then using that for whatever specific thing. And you're looking here at social media, right? This course already does give different social media outlets and recommendations there. But again, pick one first thing. So recommendation here, presented in small scaffolding lessons that begin with the basics, increase the level of difficulty, as so on and so forth. So where you look at that, right? First session first, Facebook, and you're probably watching this on Facebook and thinking, okay, well, why would you put me on a Facebook lessons? But again, what could you actually teach your baby boomer parent or companion or, so-and-so about computers that might actually help you interact with them, which may help you do your job better. It may help them do their job better, may bring your family closer together. This, that, or the other is all the benefits that you can enjoy by, right, trying to engage our older adults and teach them how to use these different platforms. And, you look at the different strategy of how to introduce it, go on through this. Some people are, love go to school kind of people, right? You want to go and you want to take the class. You want to know why Facebook, how to use it, how to make the account. You want to go through it formally. You've got your certificate and it makes you feel A-okay. So, for the people that need the masterclass, go take it. And I'm just telling you guys this and sharing you guys this for, a resource to just be mentally aware and, emotionally aware or whatever of those people in your life that may benefit from, being able to use social media, and realize that some people may have different barriers to why they want to use it, whether it's a physical hindrance, mental hindrance, and attitude hindrance. How can you show somebody the benefits of using social media, even that process of connecting with an older person, to use social media and things like that, teach them is a beneficial process for both of you, which I'm going to move on to here in Tech Talk, which in our Enlightenment Hour, which is talking about the benefits of reverse mentoring. So, have anybody really ever heard of, what reverse mentoring is before? I think it's interesting, right? So, going to just be sharing this above. Definitive guide to implementing reverse mentoring in 2023. A powerful concept gaining tractions recently as organizations, for here, even, families can do this. recently as organizations recognize the need to bridge the generational gap in the workplace. With technology advancing rapidly, new ideas emerging constantly, it has become crucial for businesses to tap into the knowledge and expertise of their younger employees. According to a survey by PwC, 75% of senior executives believe a lack of digital skills within their workforce is one of the most significant threats of their business. Seasoned leaders, while experienced and wise, could struggle to keep pace with rapidly evolving technologies and shifting cultural norms. Conversely, younger employees bring fresh perspectives, digital prowess, and an innate understanding of emerging trends and all the other things younger employees bring, right? A lot of volatility and risk. Don't know if they're going to last. Young people don't have too much wisdom or anything like that. I'm one of those guys too. But again, it is interesting though. Reverse mentoring flips the traditional mentor mentee dynamic, empowering younger employees to become mentors for their more senior counterparts. By bridging the gap and fostering two-way knowledge exchange, reverse mentoring enhances technical skills and nurtures a culture of mutual respect and collaboration. So, looking at the generational gaps here, baby boomers between 46 and 64, Generation X 65 to 80, millennials 81 to 2000, Gen Z after 2000. So reverse mentoring allows older generations to learn valuable digital skills from younger ones. Baby boomers, Generation X, some millennials may need assistance navigating new software, social media platforms, or digital connection tools. So again, looking at even Gen Z, helping to enable older generations to build and bridge the digital skills gap. Grandparents, have you tapped into your grandkids to help teach you some of these things? Do you care? Grandkids, children, have you thought about bridging those gaps for your parents and helping think about what those benefits might be? Skills transfer. Younger employees can help to thus cross pollinate. I like to call that, because where you're giving, one person the valuable skills that they may not know and empowering them to, put that in their own wheelhouse. Again, what's that veteran employee going to be doing at the same time? Offering, again, invaluable insights to things like complex problem solving, leadership, and decision making. So, again, things like ironing sharpen iron and reverse mentoring are good too. So, to those millennials or even Gen Z people out there, I do challenge you to look to your older generation and think, hey, shoot, I might be able to be a mentor. And I don't even realize that, that's something that I have the capacity to do, or, I might be, somebody would actually care to hear what I have. That's what, again, we want to be able to show you guys, just jump in there, teach somebody how to do something that they don't know how to do, and watch how that takes off. In our tech talk, if you're reading there, 30%, you can potentially reduce depression by up to 30% by teaching an older adult how to use social media, and connecting people back with their families, social engagement, data processing skills, just fine tuning those things. Very, very important. Like, studies are literally there looking at it. I thought a very, very important study from China, and I thought this was interesting too, just because, on top of this, China has a very, very different way of regulating it, but at the same time, they know the same thing as the benefits of what they're seeing there. So again, I'll just share this real quick. Effects of social media use of older adults. This was an empirical analysis based on 2017 Chinese General Social Survey. But showing this, here, it took, a very large amount of Chinese population here, and running through all of the reports and the studies on the impact of social media use on health, focusing on, subjective well-being. Research indicated that Facebook can serve as an effective tool for resisting isolation and promoting socialization. Social media, such as QQ and Weibo, and these, right, are not ones that we're going to be using here, help. So again, how internet use affects the health of older adults is a current research hotspot and priority. Importantly, the internet can improve the mental health of older adults by alleviating loneliness. The internet can help older adults overcome the barriers of time and distance and increase the frequency of social interaction. The internet can also help older adults increase their social capital and maintain social contact, each of which can help them combat loneliness. Proving happiness is also an important factor in the internet's promotion of mental health in older adults. Self-expression on social media, the use of the internet to promote self-cognition, learning, social and entertainment activities can all improve the happiness of older adults, right? Doing little projects, using YouTube, Pinterest, whatever it may be. On top of that, joining virtual communities, which can help provide a sense of belonging for older adults to assist in the re-implementation of social embeddedness, for instance, and provide social participation opportunities for older adults. So basically, this whole entire analysis, 110% supports significant positive correlation between social media use and the health of older adults. Second correlation between social media use and mental health of older adults is more significant than physical health. So again, where loneliness might be the first thing to start causing negative health problems, curing that with the internet, social media, by digital means, literally showed here a more significant correlation than physical health. And again, there's a lot to say there and a lot to digest, but that shows, the brain and the mind and that power of connection and love is a very strong emotion. And you can go and look at all of the, body labs in America where people can go and look at the mass of somebody's quad that died versus that exercised versus somebody who didn't. And you can do all the correlations about length of life and quality of life and, all the associations, so on and so forth. But, without even that being a factor, somebody just being not lonely, being connected, being with, their people, you're already negating all that. So where do we look at the aging population, healthy aging month, a way to really non-pharmacological way to help our older adults age? Engage with them on social media, use social media. Simple as that. Teach them, do some reverse mentoring. That's kind of, some general, feels like general, easily said advice, easier said than done, because it's easy to be not present or, just quick to do whatever you're going to do in your life anyways and not help that person get to where they need to get. And especially if you don't necessarily know the path or what getting to where that they need to get may actually help them, help you, enjoy a better life with your family or whatever that may be. A better, you teach, reverse mentor someone at work and you guys have a better workplace and better work culture for it. That's just benefit. And it takes a little bit of work. And that's that part where just right on the other side of that, there's a whole lot of good stuff. So again, Healthy Aging Month, do a little reverse mentoring, help people age. Bada boom, bada bing. Sure, we can learn a lot from cross-pollination. Cool. So moving on, guys, Herbal Wellness Corner. I'm jumping in talking about cannabis use in skilled nursing facilities. So I'm looking at this study. And again, this one was showing, we've talked a little bit about this before, but I want to show it again because medical cannabis in the skilled nursing facility, a novel approach to improving symptom management and quality of life. Let me fix the screen. Sorry about that. So again, looking at this, studies, older adults utilizing medical cannabis legally demonstrated significant decreases in prescription medication use, most notably in opioid analgesic use. Such medical cannabis should be viewed as an additional option in a clinician's toolbox. But I'm going to show you guys exactly how they did it. So this is the study. We can't get access into the entire full text without paying for it. But what I do have for you is the juicy parts of the study from a presentation that we were a part of, the International Society of Cannabis Pharmacists. And this was, again, I believe, Dr. Sulak, using this study as a super great example about medical cannabis laws, prescriptions, changes associated with states having medical marijuana law in numbers of Medicaid prescriptions for drugs used to treat medical marijuana indications. So interestingly enough, where you see some of these changes, but check this out right here. Medical cannabis in the skilled nursing facility, a novel approach to improving symptom management and quality of life. So, this facility here, the Hebrew home at Riverdale, they literally created their own policy and procedure for how to implement medical cannabis as being an option for seniors with symptoms. And this is what ended up becoming of it. And this is so cool. So it became, they had to literally break the ground on writing their own process and creating a system for it. And then they put a study on it. So that's what I really like about it. And the Hebrew home up there in New York has done a fantastic job. Again, I believe they are doing this out in Israel, and that's the model that they're trying to follow out there. And that's where they're a little bit more progressive in terms of including cannabis in medicine. So looking at this thing, to avoid violating federal laws, residents must purchase their own cannabis directly from a state-certified dispensary. Facility provides an individualized lockbox to each resident for secure cannabis storage. That's cool. Facility provides lockbox for cannabis. Interesting. Residents must be able to self-administer or may designate a caregiver who is not a staff member to do so. Medical cannabis fact sheet was distributed. So, that's what patients getting. That's how that's looking. Again, out in the Hebrew home, residents were eager to learn more about medical cannabis and were enthusiastic at the prospect of reducing or eliminating other medications. And this was like their policy here. So again, literally there was an entire procedure of eligibility, how to get either the physician or the nurse practitioner to recommend the medical marijuana or cannabis, right? They had to put it in the EMR, electronic medical record, in order to actually initiate the use of it. And then that was recorded on top, right, of putting it into that New York system. So very interesting. They had the entire procedure, how to purchase it, the self-administration of it. The nurses were not going to be liable. And it gets entirely into this. So again, we're not going to see this entirely perfectly, but look, will self-administer cannabis product as physician or nurse practitioner recommends. Patients who are unable to self-administer should designate a caregiver to assist in the role. Use of cannabis product will comply with the facility's policy and procedures set of self-administration. Patients who are using medical cannabis product recommended by a New York State registered physician or nurse practitioner in the community will also be required to comply with facilities, policy and procedure of self-administration. So that's what they're saying. You have to give it to yourself. That's basically the biggest, stipulation there, that nursing homes traditionally are administering all the medication to people. But, there were participants that were able to do it. And this was the cool part. This is what I like. Medical cannabis showing here, true results. 71-year-old male for pain, less discomfort, coming out of the room more. Comments. 100-year-old female for pain, improved appetite, reduced her opioid dose by 50%. 62-year-old male for pain, participating in more activities. 82-year-old female, Parkinson's disease, minimal effect. 86-year-old female, pain, improved sense of well-being, reduced opioid dose by 50%. Yeet, yeet. 88-year-old male, Parkinson's disease, pain, mild improvement in pain. 86-year-old female, seizures, resident nonverbal due to advanced dementia. Staff observing significant reduction in seizures. Interesting. 88-year-old female, pain, feels better overall. 79-year-old female, Parkinson's disease, mild reduction in stiffness. 80-year-old female, pain improved. Opioid change to as needed. So, guys, Herbal Wellness Corner talking about, where could we really do a dent? It's the skilled nursing facilities. Geez, all their options there are, benzos. There's no options. Trazodone. And half of these are going to be Beers criteria meds. And I know cannabis federally has no approved medical use, but when you're looking at Beers criteria and things like that, it gets interesting. So I'm just showing those other options, right? Benzo, 7.5% in another study. We're able to reduce and stop. Other things, TCAs like amitriptyline, right? Highly anticholinergic, sedating, cause orthostatic hypotension, can cause falls. Antipsychotics, increased risk of cerebrovascular accident like stroke. Greater risk in cognitive decline and mortality with persons with dementia. NSAIDs, benzos, opioids, guys. When we're looking at seniors, there's so much there that cannabis can possibly intervene with. Muscle relaxers. Where is cannabis better in every single situation? Can you actually substitute it? Narcotics, opiates, anxiolytics, benzos, antidepressants, NSAIDs, non-opioid analgesics, other sedative hypnotics, muscle relaxants, antiemetics, anticonvulsants, anti-migraines, antipsychotics, PPIs. Shada boom, shada bing. Gosh, guys. That was a survey with 2,473 people who were able to substitute in our senior class. So, sheesh. That is insane. So, Sharon here, Community Spotlight. Shouting out Centennial Hawks Cheer program again today, guys. If you order Papa John's pizza with, this code here, 2059PN, you will support Centennial High School cheerleading today. 20% of your order will go to the school. So, boom, boom. Who's ready for some pizza? Yep. Go ahead and do it. I dare you. All right, so our Men's Health Minute. Last thing that we're talking about today, guys. Gout. Who knows what gout is? Who's had gout before? Who knows someone who's had gout before? Gout, you're looking at your joints, your fingers, your toes, your elbows, right? You will get crystal buildup. Crystal buildup of what? Uric acid, building up in the blood, forming crystals in the joints. So that causes joints to become inflamed and painful. Men in our Men's Health Minute, of the many things we don't go to the doctor for, all the more reasons to go get our labs done. By drinking alcohol, eating foods that are rich in purines, lots of red meat, guys, plus that family history, plus age. In our Men's Health Minute, you may be at a very, very, particular point to get gout. If you know somebody who's ever had gout before, it's not fun. You don't want to get on medication for it. You don't have to do all these things. You're going to be more likely to get gout if you've got things like type 2 diabetes going on and all these other factors. If you are an alcoholic, not going to the doctor, you're eating a lot of red meat. These are very things that can just be silently, building crystals in your joints that can eventually get very painful. So, what can you do? start drinking more water. Try to reduce some stress. Add some more leafy greens into those diets. Add all the fruits and vegetables and whole grains that you possibly can, and try to reduce that red meat and alcohol intake. And exercise, every day or as much as you can. Get those steps. I guarantee you're not going to see a whole lot of gout going on. It sounds a lot easier said than done, though. So I completely understand. Gout can be painful. Yep, so that's our Men's Health Minute. Nice quick one today. I've got to actually get jetting. We got a new live stream coming up next. I'm going to be on with the Barnetts, Sherman and Christy Barnett of Barnett Harley Davidson, here in the next about 30-45 minutes over at Vado Speedway Park. We're going to be talking racing, guys. This is going to be awesome. I'm so excited. So